House, Senate, or as a congressman, John Larson's name is one that just about everybody across the state knows, not just in the first district. So, please join us. Something to say, John. Thank you. Please take the mic, choose whichever, they're both live, and tell us first, give us about 5 minutes of things that you are currently engaged with, specifically in the arena for people with disabilities.
Social Security, Social Security, Social Security.
You heard us just talking about the marriage penalty, right?
Well, listen, we have the most comprehensive bill in Congress, Social Security 2100. And, you know, when you look at America's #1 anti-poverty program for the elderly, and most people don't realize it's the #1 anti-poverty program for children as well. And I make everybody in Congress a card. I call it their Social Security card. And on that card it says how many constituents you have on Social Security. And then it further says how many receive pensions, how many receive dependent coverage, and how many receive spousal coverage. And how many people are on Social Security disability?
Does that leave anybody in the constituency that's not? That's pretty much it.
But in the state of Connecticut, 77,000 receive disability payments. Now, when's the last time Congress enhanced Social Security? Richard Nixon was President of the United States. And so for 53 years, Congress has gone back and forth. There's fingers that can be pointed both ways, but Congress needs to act. And this is my main focus and mission in Congress is to pass Social Security reform. And by reform, I mean enhancing the system. When you hear someone say, I want to protect Social Security, that means the status quo. That means the same Social Security that was in effect in 1971. Have cost of living changed a little bit since 1971? You know? And how about a number of the issues you went over? How about more than 5 million of our fellow Americans get below poverty level checks from the government that they paid into all their lives? 5 million, and the most of them, by the way, women. And of the women, most of them, women of color. It's a shame. And that we can't act and vote as a Congress to change this. The average Social Security payment for a male is $18,000. The average for a female is $14,000. And for these 5 million plus, they're getting below $12,500. How can you possibly live on that today? And then, as you were mentioning before, also for people who've had dual jobs. I'm a former teacher, and so people that have been impacted by WEP and GPO, etc., they have to be repealed. Now, there were a couple of bills to do that. One that wasn't paid for. The other, we paid for it. You have to pay for these things. Why? If you pass a bill that's not paid for, where does the money come from?
Good question.
Out of the Social Security Trust Fund. So all those people I just mentioned before, that means they would be getting less of a check. And Congress, if it doesn't act by 2033 now, there'll be a 20% cut across the board. Many in Congress would like to see that. Just take no action to go, whoops, we told you that program wasn't working. And also by raising the age. And so when you hear people say to you, hey, you know, all we have to do, people are living longer, we just have to raise the age. For every year you raise the age, that's a 7% cut in benefits. So they want to raise the age, Republicans have called to raise the age to 70. Well, that's only 21% across the board. I mean, if you're going to live longer, do you need to live on less? Of course not. And how hard is this? What President Biden has proposed makes all the sense in the world. Lifting the cap on people making over $400,000. Raise your hand if you're making over $400,000. You know, funny thing about that, you're raising your hand? Oh, no.
Oh, she's doing sign language.
I did actually have one guy in East Hartford who I knew raised his hand. I said, "You're making over $400,000?" He goes, "No, but it felt good to raise my hand." So, but the point is this: they are currently paying nothing or de minimis amounts into our national safety net for the system of capitalism and entrepreneurialism. It's the brilliance of Roosevelt still lives on. All it takes for Congress to do is vote and enhance this in a manner that will still provide us with what people need to sustain themselves. And oh, by the way, on that card also, I tell everyone how much money comes into your district monthly for Social Security. Why? Because I say this is the best economic development plan for any congressional district. On average, Diane, every 435 congressional districts, over $200 million a month comes in. That's what it was in 1971. That's what it still is today. Imagine if we put that money back in. Where do they spend that money? The grocery store, the pharmacy, the dry cleaners, getting gas in the car. People need this to sustain themselves. I guess you could tell I'm a little passionate.
Yeah. And you always have been. Congressman, I just want to ask you a couple of other questions that are not necessarily Social Security related. Here's something that's really becoming a bigger and bigger issue, having to do with mental health. And there are many people in the mental health advocacy arena who believe that the most effective treatments occur when individuals find their own pathway to recovery and avoid a law enforcement response. We also are very familiar with the fact that people frequently are calling 911 because a family member is having a mental health crisis, and instead of a mental health worker coming to care for that person or try to de-escalate it, it's a police officer who may not be even trained in how to handle that. How do you think systems of care should operate for people experiencing mental health stress? And what do you think about increasing federal funding for non-medical first responders?
Absolutely. It's common sense. And sometimes that's in short supply in Washington, D.C., but it shouldn't be. And I think the most important thing that I've learned in my time of Congress, and why these gatherings are important, what you need to demand of your legislators is not what they think about it. Will they ask for a vote on it? Again, one of the nation's premier programs, Social Security, hasn't been voted on to enhance the program in more than 20 years. So here's a very logical concept, full of passion and understanding in what's happening, and especially giving our greater understanding today about mental health issues. I'm sure the police officer doesn't want to know either, but people panic, they don't know what to do, etc. So it would make all the sense in the world, and the federal government should be involved in this.
You know, and in states where this is happening, the mental health responder is called at the same time as the police officer, and they show up simultaneously, which
makes eminent sense.
Or just in
the event that there was some...
There's been so many tragedies where somebody in distress is misinterpreted. I want to ask you a little bit about, because this has been affecting some hospitals in our state as well as physician practices. This whole business about private equity firms taking over physician practices, taking over hospitals, and as we've learned from some of the reporting that's been done, what they end up doing is, in order to increase increase their profits, they're doing things like hiring less qualified staff, sometimes uncertified staff. They're selling off equipment. We have hospitals in the state that have stripped equipment out of the equity firms, have stripped them out, and then are expecting to still be able to function as a hospital. What do we do? How do we control this?
There's no choice, that's the health.
Yeah.
As usual, they'll probably end up having to study it, which is, don't get me wrong, studies are important, yet there are things that you need to understand in depth and look at the ramifications of any piece of legislation that you put forward. But when you see common sense things like this, and when you state the obvious, and it's pretty easy to discern that this was profit motivated, not health motivated. And then the other side would say, well, that's great, Mr. Larson, but where are you going to get the money from to make sure that you do this? And it all comes back down to money. And again, that's where you have to look at, that's why you have to rely on state and federal governments to work collaboratively to say, there's got to be a way for us to do this that doesn't compromise A, the hospital, but more importantly, B, the patient, to make sure they get the kind of care that they need.
And really, in the healthcare system now, we're facing so many conglomerates, people with disabilities in particular, because we have conglomerates that own the wheelchair vendors, the drug companies, the hospital health systems. They're really monopolies in many cases. And so people feel they don't have anywhere to turn, really. And breaking up a lot of monopolies is what the federal government needs to do.
Exactly. And at the end of the day, it's people that matters, and consumer protection and making sure, especially in the area of healthcare, it's going to be vitally important that we do have the kind of oversight that can bring about the kind of change that is common sense, practical, and I dare say affordable as well, if everybody pulls together. I don't think it's any more complicated than that, Diane.
One of the things that we know, and lived in Connecticut for so long, is that housing is always a problem. There's always been an issue of not enough affordable housing. So my question is, we talk about affordable housing for people with disabilities, but the housing is not accessible. The housing doesn't have universal design. Can the federal government step in and make sure that any housing that is federally supported or subsidized has to be universally designed so that anyone can live there?
Absolutely. And that's the way it should be. Again, I think these are pretty common sense, straightforward manners. So the federal government has responsibility to make sure that if you're a builder, now obviously both state and local governments play a role in this as well. I'm not trying to usurp any of their authority, but the federal government has got to say, this is what we are prescribing nationally to make sure that there is accessibility. And whether you're a builder in a community, a state, or for the nation, or any federally funded program, that absolutely has to be written into regulations. That's not a hard thing to do.
I have to say, as you know, I'm teaching at the University of New Haven now, and I have a student who's a pre-architecture major. And when I asked her what inspired her to choose that as her major, she said that she has a brother who has disabilities, and that she's been so shocked, even at her early stage, she's only 17, 18, at all the places that he still can't go, in spite of the ADA having been passed so many years ago, that her idea is that she wants to think of new innovative ways to put universal design in all kinds of housing, all kinds of public locations, everywhere. And I thought that was really quite something for such a young person to think about. I think so in such a large way about it, not just something small, do this, but really she wants to find a way to do this in a really broad way, which I thought was very interesting.
That's fantastic.
I think that, we're raising kids now who are much more aware of these things than probably you and I were when we were kids, right?
Yes, no question about it. I have the next generation of Americans are going to surpass all current generations, and far from being fearful about the future, I'm optimistic because of your children and our children and our beliefs in this country, the need for its education, and the need also for the kind this case, a young lady who's an architect is thinking big and thinking about, well, she had a personal experience, but she's going to be impacting people far beyond that, and that's what makes it a great
And,
country.
I really do think that this is a different generation. I know when you and I were in school, there weren't any disabled children in my class because they went to separate classrooms or they went to separate schools. Now that they're integrated, I think that it's so much more common for young people to be perfectly comfortable, not just comfortable, but be perfectly accepting of the fact that everybody should be able to live the way they live if they aren't disabled.
Absolutely. It's common sense, and it's in short supply
Yeah,
sometimes.
that's for sure. Well, thank you so much for joining us today. It's always a pleasure to
It's
see you.
always a pleasure. Thank you, and thank all of you for your efforts. Make them vote.
Make sure to vote. Register is one thing, you must vote.
I'm talking about the elected officials once they're in.
Oh, okay. Thanks so much, Congressman. Good to see you.